Can bad head and neck posture cause ringing in your ears? How is this even possible, and are there any treatments? All of that in today's episode. Hello posture lovers, welcome to week 7 of Posturing 101, where every Wednesday afternoon I'll be answering one of your questions by video. This week is 2 days delayed because I've been flat out with a nasty cold. Make sure you're following my Facebook page /Posture Doctor and that you subscribe on YouTube so you never miss an episode. And if you've got a question for me about your posture or health, simply post it on my Facebook page with your name, where you're from, and your question. If your question is selected, I'll give you a personal shout out and of course an entire video made just for you. Let's jump straight into this week's question from Denise Pyatt, who asks, does forward head posture cause ringing in the ears? I've seen an ENT, ears, nose, and throat doc, in conjunction with an audiologist, was told no hearing loss and most likely was stress. Okay, can we please stop telling people their problems are just stress? If we don't know the answer, isn't it okay for a doctor to just say that? Okay, she's noticed an increase in the amount of pain in her neck, and she's wondering if the cause of the ringing is neck related. Denise, thank you for this excellent question. But quickly first, for those of you meeting me for the first time, I'm Dr. Paula Moore, the online posture doctor, and I've been helping people correct their posture for 20 years. As your posture doctor, I'm not here to highlight your pain and symptoms, but to focus on the inside of your body, the alignment of your spine, in other words, the root cause of your problems. Back to Denise's question, so ringing in the ears, or tinnitus, sounds we hear in our ears, ringing, buzzing, roaring, clicking, hissing, humming, and crackling. And I've created 3 sort of main causes of tinnitus. I've grouped them together. The first is benign, nothing really to worry about. Earwax actually has a function, believe it or not. It helps to keep the ear canal clean. But if it dries out, especially as it can during the winter months if you have a furnace, it can clump together and cause a blockage. So see your doctor. The second group is medical and often accompanies hearing loss. If you suspect you have hearing loss, you need to get a hearing test to your doctor. So infections, they can also cause fluid in the ear to build up. Now this is important. Remember that the majority of ear infections, well over 70%, are viral, so antibiotics should not be prescribed. Just say no. Other diseases that fall under the medical category would be diseases like Meniere's disease. There's a triad for that, 3 things: hearing loss, tinnitus, and vertigo, or feeling like the room is spinning. That's what vertigo is. Another disease, otosclerosis, excess bone growth over those small bones in the middle ear, and that causes hearing loss. What about the third category, our head and neck posture? When the head moves forward, there's an increase in the muscle effort in the back of the neck and upper back. Forward head posture also causes compression in the upper neck joints. This leads to chronic neck pain. And thirdly, there's a relationship between neck pain and TMJ dysfunction. TMJ is the jaw. So if you're saying I have TMJ, well, I hope you do because you've got a jaw. What you mean to say is I think I have TMJ dysfunction. So dysfunction in the jaw from forward head posture can cause jaw pain, headaches, vertigo, tinnitus, because the jaw shares some of the same muscles and nerves as your middle ear. Aha! What does the science say? Here's a small study in the Journal of Orofacial Pain, 1995. They looked at 33 subjects with jaw disorders, and they found that the head was further forward in the group that had jaw problems. This larger study in the Scandinavian Journal of Rehab Medicine, 1999, they looked at 483 people from the population as a whole. Almost 39% of them had neck pain at some time in the previous 12 months. And of that 39%, almost half, 47.4%, had jaw dysfunction, whereas only 28.6% had jaw dysfunction in the non-neck pain group. So in other words, people with neck pain, and we know from the previous study that forward head posture and neck pain are associated. So people with forward head posture have neck pain. And those with neck pain have a much higher incidence of TMJ dysfunction. So what does it all mean? If you're wondering if your tinnitus is the result of your forward head posture, and if your forward head posture is causing TMJ dysfunction, let's take a simple test. Number 1, does your tinnitus change when you chew, yawn, or cough? You can try that on your own. Number 2, does it change when you move your jaw forward, jutting it forward or side to side, or when you clench down on your teeth? And number 3, does your tinnitus change when you move your neck, turning it side to side, moving it front to back? If you answered yes to any of these, your tinnitus is likely due to the TMJ problem, and the TMJ problem is likely a part of your forward head posture. Here's my tinnitus triad. Poor posture, in particular forward head posture, leads to jaw dysfunction, and jaw dysfunction leads to tinnitus. Forward head posture puts stress and strain on the tissues and structures of the head and neck, leading to TMJ dysfunction. The jaw and inner ear share the same muscles and nerves, meaning that jaw problems often get translated into middle ear symptoms like tinnitus. Wow. So you've got tinnitus. How should you treat it? Well, we could follow the usual medical approach and treat the immediate symptoms. You've got tinnitus, so we could try eardrops and antibiotics and maybe even noise therapy. But guess what? The tinnitus always returns because you haven't dealt with the cause. We could treat your jaw dysfunction, and that would probably be better and have the tinnitus disappear for a while, but you'll keep paying for TMJ treatment, and the symptoms will usually return. Or, you got it, you can fix the underlying cause of your tinnitus and correct your forward head posture. So how do you do that? Let's take a look.
I designed this course for anyone feeling insecure about their forward head appearance, and those who recognize that correcting their head and neck posture is going to take more than a quick fix exercise, but feel motivated to learn. By the end of the course, you'll know what caused your forward head posture, and there's a good chance it might not be what you think it is. You'll recognize some of the unusual signs and symptoms and understand that it's the position of your head that has been causing some of your suffering. You'll learn a few new exercises and find out if you're a candidate for further medical investigation and what questions you need to ask. I'll be teaching you everything I know about forward head posture, and believe me, I understand your struggles because that was me.
Now's your chance to enroll on my forward head posture course. This is currently my all-time best-selling course, and you can preview each of the 45 lectures in this course when you click the link below. This course means a lot to me as I show you exactly the exercises I use to correct my own chronic headaches and forward head posture. I'll also include a link in the description below to that course if you're watching on YouTube. Thank you so much for watching this week, and I'll see you all again in 7 days' time. Bye-bye for now.